right, good evening, everybody. Welcome to the Coronavirus Update Show. My name is Omari, Salisbury. As usual, I'm joined by producer extraordinaire, the overachiever, the head of the class, producer Nikki Barron. What's up, Nikki?
Oh, just, being super busy as I normally am, trying to catch up from the weekend on my headlines and the clips. And yeah, it's been a good busy Monday. One of those ones where you feel like you got a lot done.
All right, good stuff. Good stuff.
How are you?
Man, I'm all right as usual. Up at 4:30 in the morning every day. This is my third show today, maybe the fourth show. So just after it, so to speak. You know what I'm saying? But otherwise, yeah. I'm good. I'm good. Did you see the morning update show this morning? It's brand new.
I did. Yeah, we're still working out the kinks on it, but I'm really enjoying it. It's kind of nice for you guys to have that news anchor desk now.
Yeah, no, it is. It's a real good feeling there. All right, so producer Nikki Barron, as usual, the Coronavirus Update Show. We start with the numbers, so let's get right to it.
Yeah, let's get right to it. So I've got my handy dandy dashboard here. And for the numbers, we've got another 455 coronavirus cases and 22 deaths have been reported in Washington state, bringing the total number of diagnoses to 345,731, which includes 5,063 deaths, according to the State Department of Health. We are sitting at 19,677 for hospitalizations. And then let me get our number here. It's another different dashboard that I got to pull up to get our positivity rate. Sorry, guys. Didn't mean to be a little behind here. Didn't write my note down there. But let's see here. We're checking this number. All right. All right, great. I got it here. So our ICU capacity is at 81%, and our positivity rate is at 70%. So we're doing pretty good here. The entire state is still in phase 2. So we're doing pretty good. And those are our numbers.
Yeah, well, I mean, it's a lot in the numbers, but it looks like overall, there's always the people, the eternal pessimists. And I know that you are one of those people to fall in that category because you're overly cautious, and you've actually had a lot of family that's been directly impacted by COVID as well. And the thing is, when we were talking about the numbers the other day, when you talk about 500,000 deaths, which the country is well over right now, but 500,000 deaths and 5,000 of them coming from state of Washington, then we said 500,000, 10% is 50,000, 1% is 5,000. Yeah, like 1% of all the deaths. And so in a state like Washington, there's a lot of people who really don't see the impact of COVID. And I mean, that also speaks to how people listen to public health officials, because in a state that didn't really see or hasn't really seen the impacts compared to other states that had a huge mortality rate, one shows that our population centers have been listening, saying, use a mask and social distance. But also that means there's a lot of people in our state who don't really know somebody who's had a death from COVID.
Yeah, and that's just part of that concept I talked about a couple months ago called pandemic privilege. So that's one part of it, is when you've had the privilege of not actually knowing somebody who's passed away. So Washington State, we have the second lowest COVID in the entire country. I think the only people beating us right now for positivity rate lower than us would be Hawaii, and they're like at 1.5% positivity, and we're at 7%. So it's kind of a double-edged sword. It's great because we're not experiencing a lot of deaths and we're not experiencing a lot of severe cases, but it also means that we do kind of have this weird underlying phenomena of people who don't quite take it as seriously as we should. And one of those areas that we have where we've seen that has actually been recently in the legislature. So we are, one of the stories I wanted to cover today is actually that there's been a major push in Olympia from Republicans to lift the COVID-19 restrictions. So they're hoping to get people to reopen businesses to 100% capacity by April across the state of Washington. And this Republican-backed reopening proposal, it didn't say that it didn't want to have masks and we shouldn't have mask mandates, but it did call for schools to open and offer in-person learning. It calls for restaurants to move immediately to 50% capacity, which we're at 25 now. And they'd like to get us back to 100% capacity with indoor dining at all businesses by April. And yeah, that wasn't really met with a lot of support from Democrats, especially from the governor, who said, we're not going to move to phase 3 until the science says so. So that's been a really interesting one. I've got a little clip here that kind of talks a little bit more about what that bill, what that proposal had said.
Politics, and Drew, this week, really continuing the push to reopen the state, right?
Yeah, the Republicans came out with a plan late last week. They didn't want to go as far as Texas, getting rid of the mask mandate and opening everything up immediately. But Republicans, they rolled out a package that they say is reasonable, and they say it's what the people want. They're calling for all the schools to reopen to in-person education. Instead of 25% capacity, they want all restaurants and public areas to have 50% capacity, with potentially 100% capacity come April.
I trust the people of Washington to demonstrate personal responsibility and do what is necessary to get children back in school, people back to work, and our businesses reopened completely. So I say, listen to the people, open safe, and open now.
We are not following the leadership of Texas on this, because we have saved perhaps 11,000 people by following science about what will protect our people, and we will continue to do that.
So, what do you think about this concept of personal responsibility? So rather than having the Olympia mandate these smaller businesses, Republicans are kind of saying it's up to each individual citizen to do the right thing, but we shouldn't legislate for it. I mean, what do you think about that?
Man, there's a story out of Texas where that mandate hasn't even really been lifted down there all the way, because it was a week. So I think it's Wednesday. But a restaurant there is and the thing is, it serves Mexican food, but I don't think it's even owned by like Mexican people.
Yeah.
But their rule was, because a restaurant in Texas, everybody can have their own rule. So your restaurant could say like, hey, you have to wear a mask. And so now they were enforcing, saying, hey, you have to wear a mask. And now people are like, oh, they're going to report them to ICE, and they're going to report them to immigration. And it's un-American. They can't believe they're making people wear masks. So it's like splitting it up actually causes more problem. I think you're going to see more people beefing and fighting at restaurants and at businesses and some of everything else. I think that's just going to be the end result here for a while, because you have a lot of people you got people like restaurant owners. And by the way, restaurant owners, I think, were upset because they weren't included in the list of people who should be vaccinated. But you got restaurant owners who are like, hey, man, I'm just trying to protect my staff. They might not necessarily want to wear a mask either, but they're like, man, you know what? I need it for my staff. And then you got people who come in there and they're like, well, you're trying to make us wear a mask. We're going to, I don't know, report you to ICE or talk about your business bad on Yelp or whatever.
Yeah, I think the biggest mistake we ever made in this entire pandemic was telling people that the masks protect other people and not yourself. If we told everybody that the masks were your own safety, and if you wore it, you would save your own life, everyone would wear it, and it would be no question. But
that's profound, right? 100%. 100%. If it was from day one, because remember, they were like, the mask isn't about you. It's to save someone else. And man, that just tells you the nature of who we are, because as soon as it came about someone else.
Yeah. I mean, America individualism is not about community. I've never seen any policies or anything that comes from, especially from the conservative world, that is about protecting other people or building community. It's always been survival of the fittest in America. This whole idea, pull yourself up by the bootstraps and everybody has the same opportunity, but everyone's on their own and don't rely on anyone else. So I think it is, for lack of a better way to put it, it's just stupid to leave it up to individual people, because we all know that if most people are just going to listen to whatever the rule is, and so if we take the rules away, we're really just opening it up for, like you said, more beefing, but also we're taking away the legal protections of people who, maybe a worker works in a restaurant and they get COVID at work because no one's required to wear masks. They have no recourse really to take against their job about this, because there was no mask mandate. So it really creates a lot of issues that puts it on the individual person. And, we can really relieve that stress by making it a mandated thing. So I hope we don't move into that space. I also don't think we need to push into that personal responsibility. The government is here for moments like this. So let's support that.
Right. And I like I said, one thing I did see was people were talking about, it was the restaurant people. They were like, okay, man, guys want to open this up 25%. We're out here out on front for sure, but they're not included in the list of people to be vaccinated.
Yeah, and there's some pushes for a couple other groups to be added to that list. So restaurant workers are being, there's a push for that, but there's also a push from journalism affinity groups that are pushing to get us actually vaccinated. Frontline journalists, they kind of, a lot of people signed on to a letter recently that said, we've been waiting our turn. We understand that healthcare workers and restaurant workers and people in home care settings and the elderly need it, but let's push us into the next group because, we really wouldn't be able to get any of this information out if it wasn't for us. And we really do expose ourselves to a lot of people. So, but anyway, speaking of vaccinations, I've got another headline for you here. And the CDC just released new guidelines about gathering if you're vaccinated. So I've got a
CDC Director Dr. Rochelle Walensky said that fully vaccinated people may gather indoors without masks with each other or with those at low risk, such as children. 31 million people, or about 9% of the population, have now been fully vaccinated.
So I'm going to bring myself in here, and I'm even going to solo myself. Say what?
Yes. See, and you've been vaccine hesitant, and I text you random thoughts like, it makes if you get the vaccine,
So
then that means
we get vaccine and you can gather. I don't know, man. This sounds like an infomercial. But wait, there's more. If you take the Johnson & Johnson or Moderna vaccine, you can gather with friends. You can forage for mushrooms. You can go to a barbecue. I don't know, man.
Well, I wanted to go through the guidelines a little slower because I feel like PBS NewsHour, who we got that clip from, kind of ran through it. But I've got a slide here. So these are the things that they recommend fully vaccinated people can do. So once you're vaccinated, you can visit with other fully vaccinated people indoors without wearing a mask or physically distancing. You can visit with an unvaccinated person from a single household who are at low risk for severe COVID, like for children. Without wearing your mask. And you can refrain from quarantine and testing following an exposure, even if you're asymptomatic. So it would make traveling a little easier. It would make gathering with friends and family, especially the elderly, a little easier. So it's given me hope. I want that vaccine so bad.
So you can come back to the studio, right?
So I can come back to the studio because I don't mind wearing a mask. And when I come to the studio, I wear it. But there is this sort of mental weight that wearing a mask has. And so I understand why at the beginning there was a lot of people making these videos I feel like I can't breathe. My mask is restricting my breathing because it does sort of trigger that fight or flight part of your brain because we don't normally have our mouths and our nose covered. So the reason that it's hard for me to go in the studio is not that I'm afraid I'm going to get COVID from being in there. It's just that wearing the mask for 12, sometimes 14 hours at a time and only taking it off to get a drink of water or eat or go, have to go outside. That is such a little mental weight. So it kind of makes working just a little bit heavier. You're just trying to send an email, but you're just I'm uncomfortable, So, the sooner we can get, a lot of these frontline workers, vaccinated and get people vaccinated, the easier it's going to be. It's going to make life just a little less stressful, just a hair.
Yeah.
So I'm here for it. Give it to me.
Mama Walden's in the comments, and she's still waiting to see.
I know she's still waiting to see. Yeah.
Bubba Wall says she's still waiting to see. All right, so big movement up there on Capitol Hill. Well, the other Capitol Hill, the one in Washington, D.C., I'll say. Oh, you know what? I don't want to forget this, so I want to bring this up right now, Nikki.
Yeah.
Kelsey Nyland in the mayor's office contacted us and said that there's hundreds of vaccination slots available at the Rainier Beach vaccination site between March 8th and March 13th. I'm gonna put the link right here in the comments. So it's for people 65 and older. For our elders, there's hundreds of slots still available. March 8th to March 13th, the Rainier Beach Vaccination Center. And so we put the link right there. Apologies, I didn't want to forget about that. It's important information, especially for those people, clearly not for Mama Walden, but for other people who are in a hurry to go and get their vaccination. But on Capitol Hill, the other Capitol Hill in DC, stimulus, man, 1.9 trillion a stimulus package here. It passed the Senate by one vote. There was a Republican senator who had to go home for a funeral, and so it didn't come down to Kamala Harris having to be a dramatic, tiebreaker. It was 49-50, and it's passed, and it goes over to the House. But what's in there, man? It says coronavirus stimulus, but man, is it really coronavirus money in there?
The every one of these plans always has a lot of weird things in it, and as this plan. As these little additions come out, we can definitely deep dive into some of the weirder ones if we see anything interesting. But I did find a clip here again from NewsHour, and they break down some of the highlights of the things in the American Rescue Plan for the coronavirus.
On dozens of amendments, the Senate finally passed the so-called American Rescue Plan Saturday in a party line vote. It included a new round of direct payments of up to $1,400 for individual Americans making under $75,000 and an increase to the child tax credit for 1 year. It will also extend added $300 weekly unemployment benefits through September 6th.
Mm-hmm.
So a lot of the same stuff that we have been talking about for, since the last coronavirus relief package was passed. So, more stimulus money, more tax breaks for families, increase in unemployment, because unemployment right now, the additional benefits are set to expire, I think, March 17th. So they're really coming in on the skin of their teeth here to get more unemployment funds put out there. But yeah, it's pretty much what we expected to see in this package, but it's great to see it. And maybe the takeaway here for people is if you did not get your stimulus money last year because maybe you made too much money the year before, make sure you get your taxes done as soon as possible so that you can actually have your most accurate income on there. Otherwise, yeah. Otherwise, you're not going to get that stimmy. And I think this actually is about $25,000 lower than previous stimulus packages for qualification. So,
but you're well off though. So I know you didn't qualify for any of these stimuluses, but so this is really good for you to give this information as you representing the 1% and all.
Oh God, I am not the 1%. What I am is I come from a Mexican family and so, in our culture, this idea of like saving for, a rainy day is really ingrained in how I grew up. So I've always been a little saver. My boyfriend teases me. He's like, you have like little like rat holes of money. Like I see cash in different places. Like I got like a lot of different like accounts and investments. So like, I'm a saver, so I don't spend a lot. So really that's my thing is whenever I do make any money, I save it. But no, last year, other than working here at Converge, I got laid off in June from my tech job. So I've just been, I had a very different income last year than years previous, but it's way more fun over here though.
I'll say that. I'll say one thing that is when we talk about crisis creates an opportunity, because COVID isn't something that like we'd wish on anybody, but like it also brought so many skilled people into Converge. You all your D'Alessandro, Jordan Oyas, Jake Grabbrod, there's a lot of people that like pre-COVID were, they were in their industry. And so,
and This is my transition I was hoping to make in the next few years anyway. So all it did was like push me out of the nest a little bit and more into the community spaces that I wanted to be moving in anyway. So no hard feelings here.
Yeah, the community loves you though.
We have more fun.
Of course, you know what I'm saying? Yeah. Oh, and I just saw we were matching on the merch. And, you can support whereweconverse.com/shop. We got some stuff there. I really I don't have the graphic in this profile, but our mugs are out there, only $12. We got 2 mugs. We got the regular Converge mugs, and we got the Go Forward in your purpose and go forward in your humanity. And speaking of going forward, anything else for us today, producer Nikki Barron?
No. Maybe the next merch will just be my quote of me saying personal responsibility is stupid.
Oh, you always want to get us in trouble. I'm very progressive and left leaning, even though I try to keep it on the low while we're on air. But you told everybody now, so it's fine. All right, look, we're gonna get out of here. Today's
Monday. Yeah.
Oh, I'm using every show to let everybody know. March 19th. Friday, March 19th. That's our 1-year anniversary. We're going to be having a special that day from 7 p.m. to 9 p.m. Make sure mark your calendars. We're going to make a graphic for it maybe tomorrow. So we'll put a placeholder up so you guys make sure and tune in. But March 19th from 7 to 9 p.m. 1-year anniversary of the Morning Update Show. Super excited about that. I won't stop repeating this. So by the way, every coronavirus show until then, you're going to hear me say this.
We have actually so much special programming all month long celebrating. We're going to talk to some of our biggest supporters and fans, one of which is watching, Dora. She'll be on the Morning Update Show. She'll be making her debut on the Morning Update Show. Also, we're talking to some of your other commenters and favorites there. We'll be bringing on some old, guest co-hosts. We've got music. We've got.
Yeah. Make sure you get D-Hib on there too.
Yeah, we got it. So join us every morning this month. If you like the Morning Update Show already, anniversary month update show, we got some fun stuff coming for you. Feel Good Friday every day.
There it is. All right, kiddo, we're going to get out of here. You guys can check us out again tomorrow at 11 a.m. for the Morning Update Show. Until then, peace.